was able to have the program tailored for me and my educational needs.
My experience clinically has been fantastic.
The classes here at the University of Rhode Island have been challenging.
I was very excited to learn that the University of Rhode Island did have a midwifery program.
If you're thinking about continuing your nursing education, give some thought to the master's degree programs of the College of Nursing at the University of Rhode Island. A master's degree in nursing can increase your knowledge, give you greater autonomy, broaden your horizons, and help you provide an increased level of quality care for your patients. Your master's degree education will prepare you for more responsibility and help you gain greater satisfaction in your nursing career. And you may also see the master's program as an important first step toward your doctorate. Whatever your motivation, when you begin to work toward your goal of a master's degree in nursing, you'll begin a most exciting process.
The reason why I decided to become a family nurse practitioner is because I had over 10 years experience in the field of nursing, which included experience in hospital-based nursing, school-based nursing, and most recently occupational health nursing. What I found in each discipline of nursing was I could only do so much for the client, and I would have to rely on other resources. With an advanced degree, I could offer them the next level of care.
I just really enjoyed patient care, but I felt as though I had maxed out in certain areas of nursing, and I wanted to advance to a higher level.
The CNS role and the NP role together has actually been an evolution for me. I started out, I was very focused. I wasn't very focused, but I knew gerontology was what I loved. I knew that community health was what I loved, which is basically what I've done for the past 15 years. And as I started to take classes and progress in the program, it just became clear to me that as I experienced the different roles, the leadership, the education, the research, that my focus really wanted to remain clinical. So I decided at some point, actually it was when I took pharmacology, that I was just going to try to progress in a clinical direction. Gerontology is what I love, and I think the two going hand in hand will just be the perfect role for me.
At the University of Rhode Island, you have many choices of programs for your master's degree. You can choose clinical specialties in gerontology, psychiatric mental health, midwifery, and nurse practitioner. Or you may choose nursing education or nursing administration as your focus. At the College of Nursing, you can also combine programs that match your specific interests. Because you are an experienced, competent healthcare professional, you'll want to assure yourself that you have experienced, competent nursing educators to help you achieve your goals. And that's what you'll find at the College of Nursing. The faculty and staff are first-rate and will exceed your expectations.
The mentors and the faculty and staff at URI are, I feel, very unique, and that's one reason that I chose to pursue my master's degree at the University of Rhode Island.
It was important for me to come to URI because I looked into the school and I realized they had fantastic resources. They had teachers that were very supportive, very knowledgeable, as well as teachers who were working in the field of family nurse practitioners. They were not just teaching, but they were out there clinically running practices, so they knew frontline what was going on out there, and that was very important to me.
I think URI is really terrific because the faculty comes from so many different backgrounds.
The master's program at the College of Nursing at the University of Rhode Island is a unique environment for nurses who want to be challenged. One of the greatest strengths of that environment is the strong, practice-oriented clinical experience that's central to the program. That experience frequently is coupled with meaningful community involvement. And yet another strength of the College of Nursing is that as a master's candidate, you can embark on a program of learning tailored to your needs and strengths.
I've really enjoyed my clinical sites. That was a priority of mine, looking at the schools, to have excellent clinical experiences, because you can get so much classroom and then you do want to have good mentors in the clinical setting. And the first semester I was at Brigham and Women's, you feel prepared in the clinical setting.
My experience clinically has been fantastic. Currently I am working in a setting of women's health. Beyond the assigned clinical, I've also visited soup kitchens. I've also been involved in some community action programs, and it's just been very exciting to me. It's opened a whole new world. I just love it.
I fully believe in the fundamentals of how nurses approach care, healthcare, illness, and wellness. The classes here at the University of Rhode Island have been challenging. I find that the classes are preparing me for clinical practice and are grounding me in the science of nursing. It's really the application of science in the art of care.
I was able to have the program tailored for me and my educational needs. I was able to combine the two specialized roles of gerontology and mental health to suit my needs. The clinicals were set up in long-term care facilities and adult day centers and other areas where I want to work in the future. Combining classes that were offered to me, such as physical assessment and pathophysiology and pharmacology, all educated me on what was expected of me in the advanced practice role.
URI has always had a very good reputation as far as providing a broad education. When I completed the program at URI, I had so many choices ahead of me. In fact, I ended up taking 3 part-time jobs because I couldn't decide. Here at the VA, it's been very good because I actually do see young adults, I see women, and I see elderly, so it's very comprehensive here. I do coordinate the church blood pressure screening program. Every Tuesday evening I provide some health consultation to whoever shows up. They have questions about their meds or their condition, so I provide that service.
There are many things to consider when planning to continue your education, and so many concerns. You may feel your life is already so full and wonder, can I do this? You may question whether you'll get the education you want to help you accomplish the things you want to do. Contact the College of Nursing at the University of Rhode Island. Talk with us about your dreams. Talk with us about the master's degree programs we offer and how they can be customized to fit into your plans. Then let us help you prepare for an exciting future.
Well, I was very excited to learn that the University of Rhode Island did have a midwifery program. I'm in my 40s, I do have kids, and I've desperately wanted to be a midwife for years. And this did provide an opportunity for me to go to graduate school and become a midwife. I've just appreciated the mentoring and the depth of the resources that the faculty have been. They have been incredible. I feel like I hit the gold mine. I had to get over the culture shock of just not being in school for 19 years. So I was kind of mentored through that, like, I am master's material, and yes, I can do research.